Hi, I'm Karina Spoialo. I'm a general surgery resident over at Vancouver General Hospital in BC, and I'm also a member of the Planetary Healthcare Lab as well. Previously, some of our work that we did as part of the Planetary Healthcare Lab was looking at what over-investigations are done in general surgery patients. We were focused on this to really look at the environmental implications in particular, and chose to focus on the most uncomplicated patients and to see how much over-investigation was happening in that population, and if we could build a set of recommendations for how to address that, and then also look at the impacts of that over-investigation from a triple bottom line lens. So looking at the impact on patients, looking at the impact on hospital resources and cost, and also quantifying the environmental impact as well. The first environmental impact of unnecessary blood work is increasing the amount of consumables that we're using, and that's really the most important one, because when we order necessary tests, we often don't think about the giant cascade of tools and equipment that's required to process that. The second one would be the machine use and the energy required. And although in BC we have a fairly green energy source, just the volume of testing that's required means that these machines are running 24 hours a day, 7 days a week. And if we were to reduce the volume of testing, then potentially we could actually run these machines for much shorter periods of time, and that would actually be, from an operational costs, quite impactful. The third is the transport of these materials. So often they're coming from overseas or traveling fairly long distances across Canada and the United States. So that's something to be considered. And then finally, from a waste management standpoint, obviously we need to think about those practices, and just reducing how much we use will reduce how much waste we generate as a healthcare system. Sometimes when you're comparing the guidelines that you're seeing that come out of Choosing Wisely and that come out of these more national recommendations that are driven to reduce unnecessary blood work, and then you're working in an environment where you see uncomplicated patients that are receiving blood work, you realize that often we do order these tests as practitioners, not necessarily because we're looking to harm patients or we're looking to waste resources, but for other reasons, such that we're worried about missing something, or it's just the way that we've always done things. And so when we think about over-investigation and having those recommendations in place, it really creates more support for practitioners to be able to change their practice, and to provide further education on what the implications of over-investigations are also will drive providers to be able to see that ordering additional testing isn't always harmless, which is what we think it is, but actually can have a lot of impacts on the patient and the healthcare system, and on a much larger scale. Our work is focused on estimating the carbon footprint of common laboratory investigations that are ordered in general surgery patients and across most patients, which would include things like hematology tests, coagulation tests, liver enzymes, and chemistry panels. And what we've been trying to do is really get an understanding of the bit more of a granularity of what that environmental impact will look like on a per test basis. To do that, we really have to capture the complex cycle that these consumables go through, the way that they're processed at the hospital, how they get transported, and their waste management as well. What we're hoping these results will allow people to do in the future is to provide some sort of estimate into how their ordering practices are impacting the environment, and they can make those calculations using our work, which will hopefully be published soon. Some of the insights that we're finding is that there is a fairly large discrepancy between some tests that are being ordered versus other tests, and the environmental impact can differ quite drastically between those. So hopefully this will actually also inform certain force functions and EMRs and ways for people to think about and critically analyze which tests they're ordering, and it will inform how providers make decisions about which tests are truly necessary, and taking into account their environmental impact as well. There's a couple different ways to address sustainability for blood testing. The first part is really just understanding what sort of environmental impacts come from over-investigation and specifically from ordering laboratory tests. The second step would then be to use that information to educate providers to be able to show what those impacts are of this blood work. And then finally, you also want to use that as a way to drive clinical changes. So to inform practice guidelines where you're choosing the most sustainable options. Specifically where there's areas where there's uncertainty in which treatments are the best for clinical care. So there's clinical equipoise in particular. So in terms of specifically laboratory investigations, there has been some work out of Australia that's been quantifying the environmental impacts of certain laboratory investigations. However, there's still a whole ton of investigations that haven't been covered, and the environmental impacts of those have been unknown. And even though it's very helpful to have that information coming from Australia as a way to estimate what that impact is, it is very context specific, because there's going to be different consumables, different transport distances, different energies that are being used in those different countries. And so there's really a big lack in understanding the Canadian context in regards to the laboratory investigations that are ordered here. There are some emerging resources for people that want to be able to employ a basic estimation of what environmental impacts are of clinical care activities, but really the biggest benefit is understanding how the environmental impact really comes into play with patient outcomes and with costs, and with being able to use some of this data to start to drive clinical change in our healthcare system. Choosing Wisely also has recommendations that are currently aimed at reducing patient harms and reducing resources that are used unnecessarily on patients. And all of that is meant to improve patient care. Having a sustainability lens on some of those clinical care activities will further empower these guidelines and will make sure that they're being used in a way that also can drive a more sustainable healthcare system in the future. So the really exciting part about this work and about bringing together the environmental impacts of over-investigation is that often patient harms and unsustainable healthcare actually go hand in hand. So often the things that are good for patients are actually also good for the environment. And over-investigation, and specifically ordering unnecessary blood tests, is a great example of this. So you have patients that are being exposed to unnecessary harms in terms of discomfort from phlebotomy. Over time, especially in critically ill patients, the amount of blood work that's being done can actually lead to anemia in hospital and can require blood transfusions. There's been connections to people's length of stay, to mortality, all of these things from requiring excess phlebotomies and from requiring excess blood work. So it does really closely link to the care of patients. For patients that aren't in hospital and that are getting ready for surgery, if we're able to reduce some of the testing that they're required to do and that isn't of importance for their clinical outcomes, not only are the environmental benefits of this quite drastic, but also it can save patients trips to the hospital, trips to their provider, the time and energy required to review those cases. And then in addition, the hospital is also using a lot of resources to pay for these investigations. There's staff wages to consider and staffing to consider as well with running these tests. And so it really does go beyond the environmental impact, and we see that there's so many other benefits to the individual and to the system as well.